So essentially, Align fulfills the need for all three stakeholders in the complex member management space. So essentially the three stakeholders are the patients themselves and their families, the doctors involved, and the funders, the medical schemes. And at the moment, in the end of life space particularly, it's really sort of a lose-lose-lose, because you've got patients who are wanting to die at home, and 65% or more of them in the private healthcare industry in South Africa are dying in hospital and largely in ICU and high care. The doctors in the space are generally quite disillusioned. There's been over time quite a trust deficit that's built up between the funding industry and the medical practitioners, really around loss of their autonomy. And also our system at the moment is really not geared around either value-based, team-based or home-based care.
It fulfills a spiritual, emotional and intellectual need. So it really sort of brings together all of those dimensions of who I am as a person.
It's a value-based healthcare, value-based contracting is something that's somewhat of a buzzword in our industry, but in fact in terms of actually implementing it, there's a lot of work to be done, a lot of paradigm shifting by certainly the funders and the doctors in this space.
So it's not just about saving money in some sort of abstract sense, it's also about access to quality healthcare continuing to be affordable to as many people as possible. And so I think that there's both a kind of, for us, that there's a hope that the product will have an impact on particular individuals who are able to access high quality palliative care, and that change how their dying happens, but also that there's an impact on the system, which then has an ongoing impact on other individuals by allowing them to be able to afford care.
The Align palliative care product is going to offer access to palliative care which many patients at this point don't have, or if they do, it'll be very limited, so it'll be much more comprehensive. It will hopefully stimulate the creation of more palliative care teams, so that will be a more robust service that's offered patients. And I think in the end they're going to be able to have better quality of lives and have care in the place of their choice, which for most people we know is at home, in fact, and not in hospital.
What patients need and what has been shown from what families say afterwards, I think there are two big things. They want somebody who can explain what's going on, somebody to guide them, somebody to help them explore the symptoms and the problems that they're encountering. And then after that, they want accessibility. They want to be able to get hold of somebody when they've got a problem, and that helps them immensely. It gives them a sense of security. If their family member is well cared for, if their family member's symptoms are well controlled, and if they know they're doing the right thing.
From a palliative care perspective, it is a multidisciplinary form of care. Most are, but palliative care is particularly because of the varied needs of the patient. So just to explain what that practically means, practitioners can engage in a patient-centric way and patient-centric conversations. So if we look at palliative care, you have the GP, the specialist palliative care doctor, you have a social worker and the palliative care nurse, and potentially some other individuals that are involved in looking after the care of the patient. And it's important that they have a space in which they can actually coordinate the care of the patient in real time. But I think that the difference between what we do and other electronic health records is that conversation is really the nexus of everything.
are a whole cohort of people who have now done the postgraduate diploma, who are really skilled and expert and have that wonderful attitude of compassion and patient-centeredness, which is a buzzword that there's so much lip service to about patient-centeredness, but it really is palliative care that truly live what are the patient's needs, what are the patient's choices and preferences. And I think that Aligned will help HPCA and our members' hospices to tap into those resources of skilled medical practitioners who can support hospices, and the hospices can support those doctors in providing the care in the home and the continuity of care and the first line of care for the doctors providing private palliative care.
My dad did not have any communication regarding what he would like to do in terms of process with when he could no longer speak, when he could no longer consciously choose what he would like to do. Looking at the family and looking at the issue and not just addressing the actual sickness and the illness itself would go a long way in helping people being able to deal with loss much better.
The doctors are they're actually more than grateful to have a refreshing approach to their services and to essentially the delivery of care to patients that they care for. So whilst it's not going to be a walk in the park, I think it's very doable, and essentially that's because it's the right thing to do.
It's been such a privilege for me during this work to have an opportunity to meet some of the palliative care doctors and other professionals, and I really have so much respect and admiration for the work that they do, which must be so difficult and draining on a personal level. And if we, through what we're trying to achieve with Aligned, if we are able to make sure that they are fairly reimbursed for what they do, and that then enables them to continue to do what they do so well, I think that would make me very happy.
We're trying to solve something that affects multiple aspects of the healthcare system, that requires a change from multiple stakeholders. So it's not an easy thing to pull off, which means that we've had to really think carefully through lots of different moving parts. And that opportunity to try and build something that from the stakeholder perspective is simple and easy to implement and almost a no-brainer, that the work that we do behind the scenes to make that possible is very gratifying.